especially our contact tracers who have done a fantastic job. Can I also thank West Australians for overwhelmingly doing the right thing, following the public health measures, getting tested and getting vaccinated. Yesterday, 3,423 people came forward to be tested, which is fantastic to see at this time of year. The numbers show the vast majority of people are willing to do the right thing to protect their loved ones and the community at large. At 12:01 a.m. this morning, the ACT and Tasmania were elevated from medium to high risk. This means a tighter exemption list, a requirement to use the G2G Now app while in self-quarantine, and strict testing requirements. Western Australians who may have travelled to the ACT or Tasmania recently prior to the current outbreak can return, subject to the relevant quarantine conditions and required evidence. My advice to any West Australian that has an approved G2G pass and wishes to return home is to do so immediately, before any potential elevation of these jurisdictions to extreme risk, which limits avenues to return and will require hotel quarantine if you are approved. Now to the COVID update. I can advise that overnight, WA has recorded 2 new local cases of COVID-19. The cases are a 20-year-old male backpacker and a 24-year-old woman who lives in the same household. We believe they are linked to the current Delta backpacker outbreak, but investigations are ongoing. The backpacker is not vaccinated, but the woman is. They are being moved into hotel quarantine today. They are believed to have been infectious in the community, and as such, new exposure sites will start to appear. So far, that is limited to the Audi in Cannington at 6 p.m. on the 29th of December. Specific times and additional sites will be released publicly as soon as they are available. It's important that we keep checking the exposure sites daily and follow the health advice against each site, as they are regularly updated as new information comes to hand. And don't forget to check in on Safe WA. With a low caseload, high vaccination rates and appropriate public health measures, we are confident we can remain on top of this outbreak. As of this morning, 779 close contacts in total have been identified, 23 of whom are yet to be tested. Of the 23 yet to be tested, just 4 were patrons from the mess hall event. In addition, 1,635 casual contacts have now been identified, with 219 yet to be tested. WA Health are looking at a pop-up testing clinic at backpacker hostels, as we know they are a group at risk. In regards to the case of the quarantine hotel security guard yesterday, 14 close contacts have been identified, 11 have tested negative, 2 results are pending, and 1 is yet to be tested. 27 casual contacts have been identified, 19 negative, 3 pending, and 5 yet to be tested. Investigations are ongoing into how the infection occurred. At present, there's no evidence to suggest any PPE breach on the part of the guard, and we expect genomic sequencing to be completed tomorrow night. We have to expect that this could be the first sign of Omicron in our community. While we are not out of the woods yet, given the challenges of the backpacker cluster and the new cases, these are still encouraging numbers, and they give us confidence to take the next steps forward based on the health advice. As a result, from 6 a.m. tomorrow, the public health restrictions around seated consumption only and dancing will be lifted. However, due to the ongoing concerns, the indoor mask requirements will remain in place until at least 6 p.m. Friday. On Friday, we will review the situation based on the latest health advice and make a decision on whether the indoor mask requirement can be lifted or if it needs to be extended. As I said, all other current elevated restrictions, seated consumption requirements, nightclubs, dancing and music festivals will be removed. This is obviously a great relief to venues, artists and suppliers, as well as anyone who missed out on a dance on New Year's Eve. But in order to ensure that these things can happen safely, following the successful trial at the Perth Cup on January the 1st, we will now extend proof of vaccination requirements to high-risk venues and events. These high-risk venues and events include nightclubs, music festivals and major events of more than 500 patrons, where mask wearing will also be required outdoors. Pubs, taverns, hotels, and special facility licences with more than 500 capacity, or these specific licensed venues that trade after midnight. Events with an occasional liquor licence, and the Crown gaming floor. The proof of vaccination requirement will be ongoing. This is where we were going already under our Safe Transition Plan, but we are now confident to bring it forward. Proof of vaccination is a shared responsibility, shared between the venue and the patron. If a patron attempts to sneak into a venue, the patron will be liable. They will face an on-the-spot fine or possibly imprisonment. The venue also has an obligation to take reasonable steps to ensure that all patrons and staff entering their premises are double-dose vaccinated. Anyone, venue or patron, flagrantly flouting the laws will face the consequences, but this is the best way that we can ensure these higher risk venues and events are safe. There are a few ways attendees can show proof of their vaccination in both digital or paper-based form along with their proof of ID. The quickest way to get proof of vaccinations is using your Medicare online account through MyGov or through the Express Plus Medicare mobile app. If you can't get proof online, your vaccination provider, such as a GP or pharmacist, can print your immunisation history statement for you. Acceptable forms of showing proof of your COVID-19 vaccination include the Express Plus Medicare app, your COVID-19 digital certificate on MyGov, along with an acceptable form of ID, your COVID-19 digital certificate from MyGov stored in a smartphone wallet, along with an acceptable form of ID, a hard copy of your certificate, along with an acceptable form of ID, a digital or hard copy of your immunisation history statement, along with an acceptable form of ID. There is more information online at wa.gov.au on how to do this, but my strong advice to every vaccinated West Australian is to do this as soon as possible so that you're not doing it in line for an event in the future. WA's new app, which encompasses proof of vaccination and Safe WA, will be available next week, which will provide a more secure and efficient way to show your proof of vaccination. But it will still require you to do these steps, like having the certificate on your MyGov account, so it's best to get started now. And if you're not vaccinated, you should walk into a clinic or make an appointment at a pharmacy or GP today and get vaccinated. Not being vaccinated means that you will miss out. But it does mean that these events and these venues will be much safer. This approach strikes the right balance to help us move forward safely through the pandemic. While the variants may change, the lessons of COVID stay the same. The more people do the right thing by each other, the better the outcome is. The more people who come forward for testing, the more confident we can be that we are on top of this outbreak. The more people who follow the measures means we can have lighter measures in the future. And the more people who get vaccinated means the people around them are safer, especially when they're in high-risk settings. Doing the right thing by each other is the reason for our success in WA. In 2022, it remains just as important. I'll now hand to the Vaccine Commander, and then I'll take questions.
Thanks, Minister. Over 92% of West Australians who are eligible have received the first dose of the vaccines, and we have now over 84.5% have received at least 2 doses. What I'd like to highlight is that today we expect about 8% of the population who are eligible will have received the booster shot or a 3rd dose. We really want to increase that rate of people who do require to take the booster. The evidence that's emerging out of all the health advice is that while Omicron obviously is highly infectious, and we can see that throughout other parts of Australia, what we do want to do is provide the best level of protection for Western Australians by very much increasing over the next 4 weeks those people who are eligible to receive the booster. So as the Minister's already outlined, either walk in to one of our vaccination clinics, and there's over 100 right around the state, or get online and make a booking. We have a whole bunch of people, including the children from ages 5 to 11, who will be eligible after the 10th of January. But it's incumbent upon all West Australians who are eligible to take up the opportunity to get this booster dose. It protects you and your loved ones much more effectively if you have the booster dose. And we know that Omicron will cross our border. We know there's some people who are now already in quarantine that have it, that have arrived into Western Australia, but it will certainly get out and about in our community once we open our borders. And so you need to have that booster before that takes place. So with that, that's my key message to you. The measures that the Minister has just announced are designed to able to have our community operating as safely as possible in the current situation where there's only a few cases that health and police are already active in the contact tracing. So with that, I might allow the Minister to take any questions. Thank you.
Thanks, Commissioner.
The vaccination, the new act that the government's been working on, is that still anticipated coming out this month, next month? Or?
The original date was early January. I think it's due in about a week, and it's still on track to be delivered in around a week's time. Part of that is the national, I think, IT body took some leave over Christmas and New Year, so we're still on track to time that for early January.
Which hotel is the security guard working at?
The security guard was working at the Pan Pacific Hotel.
And the vaccine commander said that some people with Omicron are staying in hotel quarantine. Is that sort of a similarity? Is that why you're worried Omicron might be in WA?
There are people who have tested positive for Omicron in hotel quarantine, yes, and in the hotel that he is working at. So it is a possibility that this could be the Omicron strain, but we'll know that late tomorrow.
Did he catch it from an interstate or an international traveller?
Well, we're still working through exactly how transmission occurred, and the team are going through CCTV. We don't have that information yet.
So you don't think it was a PPE breach, though?
There's nothing to indicate that there was a PPE breach on his part. He was wearing full PPE with mask and face shield. I think what this demonstrates is, if it is Omicron, how contagious it is. And there have been some minor breaches of guests in the hotel quarantine, and we think that may have occurred due to
At the hotel when he was working there?
Yes, of the actual guests.
So what, opening of doors?
Opening doors, sticking your head out, that sort of stuff.
So is he regularly sort of situated on a floor? Is he still one of those sort of static guards at the end of a hallway? Or?
He's worked between a number of floors in that hotel. But they do limit who they come into contact with their co-workers. So they have groups that they lunch with and they break with, so that they're not going mixing widely with the broader workforce. It was picked up in the daily swab, which we introduced a while ago, and that's been helpful. And the number of exposure sites are quite limited. So he's been out to 3 or 4 places before it was picked up, and we've managed to establish all of his close and casual contacts.
A number of southwest tourism sites are also exposure sites. Is there any prospect of mask wearing being in place for the southwest before Friday?
Well, I remind everyone who has been in the Perth and Peel area since the 16th of December that you must wear a mask in public places in the southwest. There isn't a mask mandate for the southwest at this point because there's no evidence of community transmission in the southwest, but we'll review that if the situation changes.
The Pan Pacific is open to the public. How much of a worry is that?
Well, that's up to the Department of Health and the hotel to manage the public and the quarantine components of those hotels, and that's been managed reasonably well so far.
Can we get an update on the New Year's Eve party at the George? So what kind of event was it? Who organised it? How much were tickets? Will the operator lose their licence?
Well, look, in terms of any enforcement prosecutions, I'll hand to the Police Commissioner to answer those specific questions, because that is now a police matter. But I will say that it was incredibly disappointing and selfish to proceed with that event when most of the community has worked so hard to keep COVID out of WA and to keep people safe. It was very disappointing to see.
Just going back to the security guard for a second, how recent was the Omicron case at the Pan Pacific of a traveller, and has it been just one or multiple?
I think there's more than one that is in the Pan Pacific because Omicron is now the dominant strain in a number of jurisdictions, interstate as well as overseas. So there's a mix within our hotel quarantine system. I don't have that exact information because we haven't determined how transmission occurred yet, but we're working through that.
How many hotels are we still using for hotel quarantine, and when are we anticipated to go back up to that sort of 530 person international intake that we sort of reduced in December?
Well, we have 6 hotel quarantine hotels at the moment. 1 is reserved for air crew and 5 for interstate and international arrivals, and a large cohort of backpackers at the moment. There's also a number of other hotels that are procured from the Department of Communities that allow people to isolate and quarantine in if they don't have appropriate circumstances or accommodation. We are expecting less of those international arrivals over the coming weeks as we lead into February 5, and we will see less interstate arrivals with the changing of the border settings as well.
Obviously numbers are growing quite dramatically in other states. How resolute are you that Feb 5 is the date, and can you give us a guarantee?
We're still working towards our safe transition on the 5th of February, and every day that we have without widespread community transmission gives us more information about Omicron and about how we expect it may play out if it does arrive in Western Australia. We're working towards what those settings will be, but we do expect that there will be mask wearing and other public health social measures. We also have very, very high vaccination rates, and we call on everyone who is vaccinated and who is eligible to get their 3rd dose as soon as possible. The things that will provide the most protection for the community is mask wearing, public health social measures, and the 3rd vaccination dose. So I encourage everyone to do that.
Risk of ramping in 2021, is our hospital ready for February 5?
An enormous amount of work and investment has gone into the health system, particularly over the last 2 years, to make sure that we are ready, and particular with providing more beds. So we will have 530 new beds and staffed by October this year, with nearly half of those already online. We have plenty of ICU capacity with the ability to surge up to 300 if necessary, and we are embarking on an aggressive recruitment campaign to recruit nurses into the system. So I'm confident that all of the measures that we put in place, vaccination rates, public health social measures, the community abiding by those, and our hospital readiness will see us well prepared.
But there's still risk of ramping.
Ramping it's been a tough year in Western Australia last year, certainly for ramping hours. Since August, ramping has trended downwards, and in the last 3 months we've seen 3 consecutive months of downward ramping hours. So the beds that we're introducing into the hospital, the work that we're doing with those long stay hospital patients who are not getting access to the NDIS when they should, or not getting access to aged care when they should, they are being case managed individually out of our hospitals and into appropriate accommodation, and that's around 130 beds in itself. So all of that work is happening, and we're seeing the impact of that on ramping figures now.
Only a small number of those beds are going to regional hospitals. Country areas had 868 hours of ambulance ramping. Without any COVID here, so are country hospitals prepared for COVID?
Country hospitals are experiencing some challenges around recruitment, and one of the key issues impacting country hospitals is the lack of primary care or GPs. And we're certainly seeing that over the Christmas period when GPs have gone on holiday. People have essentially gone to emergency departments, and that's put pressure on those. So we're working with the Commonwealth Government because provision of primary care is their responsibility. So we're working with them to ensure that we're getting GPs into regional areas so we can keep people out of emergency when they don't need to be there.
Have you any sort of advice around when the ramping hours are expected to get below the sort of pre-COVID numbers that we've been sort of seeing? If you have any sort of short-term targets around the ramping hours you'd like to see or working towards?
Look, we know there's more work to do, and we want to see those. I certainly want to see those figures continue to come down. and I will be working with St John and the department and the hospitals to make sure that we're getting patients through and out of EDs or being treated as they need to be treated. One of the challenges, as I said, is around primary health care, and so encouraging those people who don't need to be in hospital to go to the GP is really important, and so we'll be working with the Primary Healthcare Alliance as well.
When does proof of vaccination come into effect? The one that you're talking about, the high risk venues?
As of 6 p.m. tonight.
6 p.m. tonight?
Yep.
Okay, and will proof of vaccination likely be extended to other venues like supermarkets?
We're working towards that. We're working towards all of those details around February 5. What this measure does is it targets high-risk venues and the cohort that we think are most at risk. We've got 2 backpacker infections that are not closely linked to the original infection, so that indicates there's a small amount of community transmission amongst that cohort. These events and these venues are likely to be visited by that cohort, so that's why we've put those in place now to make sure they're as safe as they can possibly be.
Just to clarify, this new app doesn't have a feature on it where someone can have a valid form of ID to show with their COVID certificate?
You need to show your ID separately from your COVID certificate.
The Service New South Wales app has that feature in their app. Is that something you'd consider to make it easier for people to show both in the same app as well as check in?
We want to make it as easy as possible for people to do this, for venues, for businesses and for the community. So we'll look at anything that looks sensible and is easy to be authorised.
The Premier said we had 8 million rapid antigen tests on order to arrive by Feb 5th, but he expected that number to grow. Have we secured any more supplies?
We're working towards a number of around 20 million. Hopefully, that's what we're working towards, and we're putting those orders in now. We're reasonably confident of supply and that we'll have a solid supply before February 5.
And what about the oximeters, which track blood oxygen levels? There are widespread reports that they are impossible to find in the eastern states. Is WA doing anything to make sure we have enough stock come February?
Our hospitals are well stocked, and we also have a stockpile of necessary equipment that we're required to treat COVID patients if necessary.
How long are those 8 million rapid antigen tests, how long would those sort of last for? Would they be anticipated to last for?
Well, we're working on the basis that people will need to take multiple tests, but we don't want them to just be used unnecessarily, which is why we haven't lifted the prohibition yet. We haven't allowed for them to be sold yet because we don't want them out in the community and being used when we don't have widespread COVID or any COVID cases as such that we need to track down. So I don't have that modelling in front of me exactly, but we think 20 million is a good number to start with, and we'll certainly be continuing to order.
How many, with the third booster shot, how many people are you anticipating or will be eligible to get it by February 5th in WA?
I've got those numbers and we can get that to you, but it's in the hundreds of thousands. So there's a significant number of people will be eligible. One of the reasons we pushed to bring that eligibility forward by a month, so from 5 months to 4 months, and it will now go to 3 months from the end of January, was to essentially maximise the number of people to get those booster shots. So we would expect hundreds of thousands of people to be eligible by then.
Those 4 close contacts from the Perth Mess Hall event that still haven't been tested, obviously that number's been brought right down from about 40, I think it was last week, but does anyone know who these people are? Do we have any certainty that they're not actually in the States, or...?
Look, I think the possibility of tracking them down is very slim now. I think the contract tracers have done an excellent job tracking down those people that they have tracked down and narrowing it down to 4. So we think the possibility of capturing them is pretty low now.
And what's the situation with those 4? They're not answering their phones, or you think they're giving false numbers? What do you think?
All of those. So it's people just switch their phones off, they're not returning calls, so on and so forth. This is a well-connected cohort, but they don't know a lot of detail about each other, if you like. So they know each other by first names. They don't necessarily have addresses. So it's been challenging for contact tracers to extract information.
Any more charges from people who...
I'll let the police commissioner answer questions about policing.
There's a really interesting question regarding some of the contact tracers. One of the viewers told me that their friend at last night at 7 got a text about the Woolworth Greenfields and Mansborough Thursday 12 to 2. There was a case there, but got told, so basically they got told to test via text at 11, and the exposure site is still not on the LVWA website. Is that true?
I'll follow that up with health.
Just on the new app, do you know, will it have a function to clearly see your history where people have checked into, so they've got a record of the history?
For the vaccination app?
For the new app, will we be checking in with that as well, or?
No, that's a separate app.
Okay.
Safe WA.
Will Safe WA include or be changed so people can see a clear history on the app where they've checked into?
Well, that information is subject to privacy, so it's really contact tracers and health that have access to that information.
You understand the Premier's on holidays. Is he following mask rules while he's there? There are lots of photos online of him outside, unmasked, but like quite close to people. Is the Premier following mask rules?
I'm certain the Premier is having a well-earned break for a few days, and yes, following the directions.
With all the border changes in terms of a lot of places becoming extreme and high risk, do you have any sort of figures around the number of West Australians who've been trying to get back to WA but are sort of stuck out there in the eastern states and can't actually get through?
Well, the border arrangements have been in place for a number of weeks now, certainly those higher risk ones, and we do give plenty of notice to people when they're going to change, and I've encouraged people with the imminent border arrangement changes to get back as soon as they can. We don't have exact numbers because people's circumstances change all the time, and we have people who need to come back for various reasons, but every circumstance is worked through very carefully by the police. And we try to use compassion where we need to, but also primarily we need to be able to keep the community safe.
Just touching on Tom's question, there are a few features that the Safe WA app could possibly implement to help people retrace their steps, but also it doesn't give the ability to check out of the venue, which means time frames could be wildly off, which adds to the contact tracer's job, as well as you can't manually check into somewhere after you've left, which means if you've forgotten to check in and you want to add that, following the restrictions in the health device, you can't do so. Is there work being done to make it more user-friendly and more accurate in a sense?
I think it's a very useful tool for contact tracers, and I think we've seen such good take-up of West Australians, and particularly when they know we're leading towards a safe transition in February. I haven't had that feedback. I think it's a great app, and I see people using it all the time.
So you don't think those improvements are necessary?
We'll look at any improvement that makes it user-friendly and makes it easier. The most important provision that we need right now is contact tracing capacity, so people's movements, and their proof of vaccination. So that's the priority.
31st of December, Group 1 vaccine mandates. Everyone has to do double jab from Group 1. Have you heard sort of anything more about how many people have sort of not done that, or does it seem to have all been from the first deadline that people sort of stopped working?
Look, I have not, and all of the evidence where we've done this in previous with previous groups, healthcare workers, aged care workforce, is that the vast majority of people actually get vaccinated, and that's the aim.
Are you expecting those figures from the Public Sector Commission though?
Later this week.
Okay.
Yeah, so later this week we'll have those figures.
When the proof of vaccination was first spoke about being implemented, it was for those aged 16 plus. Is that still the case, or will it be moved?
That is the case, yes.
And so for those people, or the venues that allow people in that are unvaccinated in those high risk areas, what are the penalties again?
The penalties are, for individuals it's $1,000 and up to $50,000 so it's $1,000 spot fine, up to $50,000 or 12 months imprisonment for individuals. For businesses, it's up to $250,000. So there's steep penalties.
So sorry, 1,000 or 5,000 for individuals? How much?
$1,000 on the spot fines, or up to $50,000 or 12 months imprisonment.
And does that? You said pubs, but is that only after midnight, or what was the clarification on that?
No, let me run through that. So that's for businesses with a capacity of 500 and more. And it's based on the licence. So it's pubs, taverns, hotels and special facility licences with more than 500 capacity, or these specific licensed venues that trade after midnight.
Does the 500 plus include religious organisations like churches and stuff?
No, it wouldn't, because they don't have a special purpose licence. So the aim of these restrictions is to target those high risk areas. So not churches or restaurants or cafes, but people where there's loud music, there's drinking, there's dancing, so that these events can go ahead but be safe.
Just back on ambulance ramping quickly. Where does WA sit on a national scale in terms of our numbers?
On the national scale, Western Australia is doing reasonably well. On the last report that I saw at the end of last year, that our ramping numbers were relatively low, and that is also including in pre-COVID for those other states as well. So Western Australia nationally is performing quite well on ramping and elective surgery. The reality is that every health system in every state and jurisdiction is challenged and experiencing high levels of demand, and much of that is due to delayed care. Certainly in early 2021 and 2020, where people were not coming forward with mental illness or other illnesses that have now developed into more chronic and acute illnesses that require longer periods in hospital and more intensive treatment.
And just to clarify, the measures, the new changes come into effect at 6 p.m. tonight.
Correct.
The nightclubs can open, but they must adhere to the mask mandate if patrons are dancing inside.
Masks and proof of vaccination.
So the event industry, in terms of the grant that's been offered by the state government, is the cut-off date of today then, in terms of the what do you say, the application period?
That'll be worked through. If events are able to reschedule, then they're unlikely to be compensated, but we'll work through that.
We have Dr. Armstrong.
Yep.
Are there any sort of working theories as to how this security guard might have picked it up, or is there just too many unknowns?
Still working through that. The security guard, we know, worked on a floor where there was some cases, and as we heard, there's been some minor breaches, people coming to the door without their masks on. We'll need to await the genomic sequencing to determine whether or not that's where the transmission occurred. That's the most likely event at the moment. So that genomic work in the laboratory will look at his genome as well as one of the people in that room, and if they're the same, then that's where it's happened.
Is there any particular reason not having a static guard there, having CCTV wasn't an option, that sort of floor or that hotel?
There's CCTV on that floor.
Can we get the Commissioner?
Before I take further questions, I'll just clarify 2 points. One is the measures that have been announced today come into effect from 6 a.m. tomorrow, not tonight. The measures that are existing, that is music festivals, nightclubs, etc., remain in place till 6 a.m. tomorrow. So it's tomorrow evening onwards, or in fact from 6:01 a.m. tomorrow, where the new measures that have been announced by the Minister come into effect. So just to clarify that, nightclubs aren't open tonight. In regards to the tavern licence held by the George, there was a question on that earlier. I expect 3 things to occur. One is that the police investigation into alleged breaches of the Emergency Management Act provisions will be a key part of the police investigation. 2, any breaches, which would also include liquor licensing provisions, such as keeping doors open and accessible, and any of the requirements that a licensee has, will also be part of the investigation. And thirdly, the fitness to hold of the licensee. So there's 3 elements. No charges have been laid as yet, but I expect that the investigation will be concluded as soon as we've got sufficient to put those matters before a court.
If nightclubs do open tomorrow night, how strictly will you be enforcing these vaccination rules, given venues haven't really had time to prepare?
Well, the decision based on health advice is for those venues that have those particular types of licences and capacity. Look, generally well established. Most of these types of facilities require proof of ID when they go in anyway. A lot of them have existing scanning facilities, such as for driver's licences and proof of age. They're well adapted. Government have already liaised with the industry sector, so they're well aware it's coming. And look, these are professional companies and bodies that are used to requiring proof of age. The only additional requirement, which we saw that Perth Racing were able to do in a short period of time, was to add the certificate of vaccination. So given it worked so well at the Perth Cup, we're confident that businesses that are affected by this will be ready and able.
Has there been much movement in terms of vaccination for Kimberley and Pilbara and Goldfields, those regions at all?
We continue to work very hard across each of those regions. Those three regions have been a key focus of the health vaccination program. We're working very closely, obviously, with the GPs, the Aboriginal medical services, the pharmacies, and of course with each of the communities themselves. So aside from people like me and others personally going to each of those regions, we are making every effort to lift the rate of vaccination. We know that this disease will not discriminate on the basis of area, age, or where you live. The disease will come and find everyone. And so that's why we are particularly focused on lifting the vaccination rates in those three regions, but of course right across the state.
Can you provide any other details about the party at the George, like what kind of event it was, who organised it, how much tickets were?
The evidence that we will be putting together is that this was a ticketed event for a fee, and in that sense the premises is subject to not only the Emergency Management Act provisions that are in place for everyone, but also their existing liquor licensing regulations, and the Act is quite particular as to how they should operate. So people who operate licences are able to offer ticketed events, but they've got to be within the parameters of the law.
Are there any other spot fines over the New Year's period, whether it be people partying on boats or other sort of events where people were dancing?
Not in particular for the Emergency Management Act, no.
It's only 4 people still be found from the mess hall event. Pretty amazing job rounding everyone up. Are there any more charges?
No, but we've just received advice from the Chief Health Officer that the 2 people who were apprehended in Margaret River, the test results have just come back and they're negative, which is pleasing. But as the Minister's already responded, we think the contact tracers and the police that have been working right through, in fact there's 503 individuals that have been identified connected to the Perth mess hall event. The fact that you've got under half a dozen that have not been able to be located, I think speaks volumes on the professionalism of the health contact tracers and the police that have been working very closely together with them. I expect that a number of these have either got false names or perhaps the numbers are wrong, or they simply don't want to be contacted. So look, it's a tremendous outcome, but obviously as the health department continue to monitor a couple of events where we know that there have been people that are contacts of contacts. That's the thoroughness that the contact tracers are putting to this.
Just back on the George, you said it was a ticketed private event. Was it organised by the venue itself or a third party? And do you believe the operator of the venue was aware of the party?
Wherever a venue is, there has to be an approved manager or a licensee present. So there's no reason to distinguish between whether a person hires a venue. They can't operate it themselves. It's got to be by an approved manager or by the licensee. So that's an existing requirement. On what I've been briefed, it was hired by, I'm not sure whether it was a company or an individual. That'll be part of our investigation, and that they charged a ticket entry.
Do you know how much the fee was for the ticket?
That'll be subject of evidence.
And will any of the people who attended the party be charged or fined?
Again, that's part of our investigation at the moment.
Sorry, I still trying again, so I can check this. So just with the relaxing of restrictions, what sort of has given you the confidence? Is it just the low number of cases, or the fact that you feel that both these sort of potential outbreaks are well contained?
Well, yeah, both of those reasons. So the number of cases linked to that backpacker cluster, we're still getting cases, but they've come down quite a lot. What we do know is that there's two pairs of people in that backpacker cluster that we cannot get direct linkage to with any of the other cases. So that gives us some cause for concern, and we think that there may well be one or more people out there that are still infected, but those two pairs of people that I mentioned live in that sort of group, and they know a lot of people who are close contacts or a casual contact. So there's a connection there, but we don't have the smoking gun. So the likelihood is that there are other cases out there. So what I would ask the backpacker community to think about is that, please, if you have any symptoms at all of COVID, please come forward and get tested. There's a good chance that there is some cases amongst your group, and just be really aware of that. And if you have any symptoms at all of COVID, please get tested, because we want to be able to identify you early and identify your contacts and keep you away from others until such time as you're no longer infectious, so we can stop this outbreak altogether.
There was some confusion at some testing sites over the past few days of backpackers who wanted to be tested, but they weren't sure if they were close or a casual contact, they weren't showing symptoms, and they weren't allowed to be tested. Are all backpackers just allowed to be tested now? Or?
No, the regulations in Western Australia are that you need to have some symptoms to be tested. So the group of people you're talking about, I'm not aware of those. They would have been told by the Department of Health contact tracers whether they're casual or close contacts, and if they were, then they would have been able to be tested. So what I'm presuming is that those people just turned up because they are backpackers without any symptoms, but I'm only surmising that.
How are the hostel pop-up clinics work? Is it just going to be in Perth, or a lot of people are saying car parks as well? It's seen from some of the exposure sites. Health authorities be sort of going to other places frequented by backpackers?
Well, there's a limit to what we can do. What we're going to try to do is to work out where is the riskier site. So that would be places that have been nominated by the backpacker close and casual contacts that we know of, where they live, also about the size of those venues. We won't be able to go to every single backpacker lodge in Western Australia because that's just not possible, or in car parks where they might be staying in vans. So it'll be a measured approach, but also based on the risk, which will be a function of whether we know about those hostels already and the number of people in them.
Do you envisage masks are here to stay for much of 2022?
Well, I think it's very hard to look into the crystal ball and say that with any sort of definite conviction. I think masks will become much more a part of our life than they have been in the past, but at some stage in the future, this coronavirus will, we're hoping, be attenuated in its severity, and it will be more like the flu or a common cold. But that's sometime into the future. So we can't really surmise about that at the moment. But I think for the immediate future, certainly masks will be part of where we're going.
Given the amount of contact tracing effort that went to these close contacts who we didn't know where they were, who weren't coming forward to be tested, do you have any sort of idea at what point, once we get Omicron coming around in WA and how fast it spreads, is there what sort of point where contact tracing won't be able to keep up? Is there any sort of number of cases in the community where that would be likely to occur?
Yeah, so we can do contact tracing to some extent, no matter how many cases there are. It just won't be so fine detailed. So at the moment we've got a lot of contact tracers on board. We've got more than 100 that have been working per day over the last since this outbreak occurred. So that's a lot of people. They can do a lot of work on a small number of backpackers and other people in these clusters. But as time goes on and the case numbers rise, you just have to go for where the bang for your buck is. So a lot of the work that we do around casual contacts, for example, and ringing people up, those things will be pared back so we can focus the efforts of the contact tracers on where you're going to get the most benefit. So contact tracing is it's on a continuum from incredibly intense that we have at the moment, a lot of resources to devote to a small number of cases, all the way through to lots and lots of cases that we can communicate to people by SMS rather than ringing them up, for example. And each time you pare back, clearly the risk increases a little bit, but that's just inevitable part of what's going to happen in the future with, as we know, with Omicron. When it does come into this state, it'll go up quite quickly, irrespective of the number of contact tracers you have. But we will still be having contact tracing in place for a while after that.
Sorry, just one
Last
last
question.
one. The Perth Cup last week, there were discussions around the emergency team around that. Were you quite happy to go forward with that, or did you need any? What was your first thought, that you didn't want it to go ahead, or were you sort of asked it to see if you could put in recommend things that would allow it to go forward, and how were you? I guess how were you happy with how it went over the weekend as well?
Yeah, so the Perth Cup was considered by the EMT and in the health advice, and it was considered, and I considered it to be a reasonable way to go forward to keep it going, as well as these other risk mitigation steps were put in place, such as mask wearing and the need for proof of vaccination. So I was quite happy with that approach.
Thanks, everyone.